We're here tonight to discuss, to debate, provide input, and take it not just back to Washington, D.C., but Austin. I sit on the Health and Human Service Committee in Austin and have for 4 sessions, and have filed probably 80 bills on these very important matters, from CHIP to Medicaid, Medicaid reimbursement rates, how we get more doctors, nurses into El Paso, how we provide scholarships for doctors and nurses to locate here, and some of the issues that these guys deal with every day in trying to provide basic health care. The way we're going to do this tonight is to lay the facts. These are the facts that all the policymakers are dealing with. You're going to see these in these slides that we present to you today. We're going to talk about the one bill that's been moved out of a committee. There are multiple bills being talked about in Washington, D.C., in both the House and the Senate. We'll provide time for questions after that presentation, and then we're going to get into the panel discussion with experts, and we have plenty of time to ask them questions too. So we ask that you hold your questions until the presentation's been made, and then in each segment we'll have questions about the material that's been presented. With your permission, I'm going to see if we can do this. Can you hear me? I'm going to see if we can do this estilo Oprah Winfrey. And I'm just going to wander around and show how these slides and work off these slides and see if we can share the information this way. Let me start with this fact. El Paso is the most uninsured city in America today. For a community of our size, 500,000 and over, we have more uninsured than any other city in America. So if there is a city that should be looking for profound change, in my view, it is El Paso, Texas. Let's look at the state of Texas. Now, what this is this is a ranking among the 50 states in these categories. The first one is the percentage of population without health insurance. This is all 50 states. Texas ranks 50th. 1 in 4 Texans have no health insurance. So as a state, we have fewer people that have access to health insurance than any other state. There's a couple of reasons for that. One is employer-based insurance. Another is the lack of some of the larger unions that you see on the East Coast and West Coast that get their employees into collective bargaining. There's other reasons, but Texas has fewer people covered with health insurance than any state. We have fewer children with health insurance than any state. We have, in terms of where the issues are in healthcare, the rise of diabetes and obesity, which are profoundly affecting healthcare costs, which these fellows are going to talk about in a minute. Now, if you look at this map is where the uninsured live by county. So take a look at the map. The counties that are in the darker red colors are higher in the amount of people with lack of insurance. The ones in the lighter colors are where you have more people insured. If you look at the Dallas-Fort Worth area, it and the Austin area are the highest in terms of the ones with health insurance. Here's Austin down here, that's Dallas up there. The border counties, rural counties, and the Panhandle have fewer people covered with health insurance, and we can talk about that and reasons why. This is a slide that shows every single Texas city. So the national average is 15%. 15% do not have health insurance. This shows that not a single Texas city reaches the national average. So let's look at it. Up there, the blue line is the United States average for the number of people that don't have health insurance, 15%. What does that mean, Mike Rooney? It means that 85% do have health insurance in a typical city, 15% don't. So let's walk down and show you different cities and the number of uninsured. Let's find Austin, San Marcos. Austin, San Marcos is in this gray color. Austin is the most insured city in Texas. Only 17.9% do not have health insurance in Austin, Texas. Let's find another city that we might want to track. Let's look at Dallas. Dallas is this pink line right here. If you go find Dallas on this chart, 25.4% do not have health insurance. Let's go and find Corpus Christi. Corpus Christi is this purple line right here. In Corpus Christi, 28.3% do not have health insurance. And then let's look at the city of El Paso, which is this line. 33% do not have it. and then 36% in Laredo, and these figures are a little bit dated. That 33% for El Paso is up. We have more uninsured than that number today. Not one city in Texas, none, reached the national average with people that have health insurance. El Paso is the most uninsured big city in America, 500,000 and up. Houston is the 4th most uninsured city in America, and Dallas is the 12th most uninsured city in America. Now let's look at, and I'd like you to watch these pie charts because they're going to tell a story. And they're going to tell a story about what's happening in cost shifting. They're going to tell a story about what's happening in those that are covered with health insurance and the government programs that generally are big participants along the border, particularly in TRICARE and programs like Medicare and Medicaid. This is Tarrant County, Fort Worth. This is the number of folks, 62%, that have health insurance. Why? You go into Tarrant County, you got big employers, General Dynamics. They're making military parts, jets and other things, covering their folks with health insurance. Different companies up there are very active in DOD contracts. They're active in manufacturing up in Tarrant County. This is the percent that are uninsured, this part of this pie, which is 23%. Now you have the government programs of TRICARE, veterans and military, Medicare, CHIP, and Medicaid. Now watch what's happening. This is San Antonio. Let's go back here one slide. When you're in Tarrant County, you had 62% that were covered with health insurance. You're going to San Antonio, you've got 45% that are covered with health insurance, and your uninsured are growing. You've now got 25% uninsured. Look what's happening to Medicare, and look what's happening to Medicaid in San Antonio and TRICARE. TRICARE is going to be big in San Antonio because the number of people connected to the military. Let's look at the next slide, El Paso County. This is an unsustainable healthcare model. When you've got 35% current numbers uninsured, you've got this number 32% that are insured. So you got more uninsured than you got insured, and you got these folks in TRICARE, Medicare, CHIP, and Medicaid, and the Medicaid reimbursement rates do not even cover cost. What these guys struggle with every day is how they're going to pay doctors and nurses in El Paso, Texas. Let me share that again. When the market is driven by Medicaid reimbursement rates, what you get is doctors and providers that can't make a go when they have clients 50% or more that are in those categories. These guys are going to talk about that. It becomes a very difficult proposition when your reimbursement rates do not cover the true cost of the delivery of that service. Next slide. Now, if you have a pie chart that looks like this, let me ask you this. What is your physician and nurse per capita going to look like? How many doctors and nurses are you going to have in your city relative to your size? What would be your guess? I'm going to have you speak into the tide. What would happen if a third don't have health insurance? What happens to the number of doctors that you've got that are in your community ready to give care?
It's much less, and I think we only have about 700 doctors here in El Paso.
Well, let's look at the facts. In the United States, because your state has fewer people covered with health insurance, you're the last state of the top 15. You're the lowest in the country for the big states in the number of physicians that you have per capita, per 100,000 in population. And when you look at the border and these communities that have high uninsurance, and you measure per 100,000 how many doctors you have, and down here is where you're running into the lack of physicians. The border area of Texas has fewer doctors than any place in America. There is no region that has fewer doctors and nurses per capita than the 43 counties of the Texas border. These 43 counties that start like this. And the reason is, if you've got uninsured, you don't have the ability to attract physicians, you can't pay them, and all of a sudden you've got issues with respect to getting an appointment to go see a doctor or a nurse. Now, let's talk about another issue that I'm going to put on the table. We got 67,000 troops and dependents coming to El Paso. And with them comes the need for 680 new doctors and 2,200 nurses. That's what we're going to need to recruit here in 4 more years because of the troops and dependents that are coming with BRAC. So if there's a city in the country that has a healthcare challenge today, you're in it. You're in it because we're going to have to lay out a profile of how we're going to go solve these issues. We're going to have to work together to incent people to come here. We're going to have to grow our own and get them through our new medical school. Round of applause for that. That's a big deal. First one in 30 years anywhere in the United States. We're going to have to get them through nursing school at UTEP. We just started a new nursing school at Texas Tech. The community college has stepped up big time in terms of how many nurses we can graduate. And we're going to have to attract more nurses and more doctors to our area. No question about it. There's not a way that we can do it if we don't. Now, let's talk about what the bill does. There's only one moving bill. And so it's very difficult in this process to say this is exactly what's going to happen, because really it's going to be a process that evolves probably on into September and October. There'll be a House bill, then another House bill. There'll be at least one Senate bill. They may divide it into 2 bills. You heard talk about that this week. But here is what's in the bills that are on the table today. So this is what we do know about health care reform that's taking place in Washington, D.C. 1, it will require that all Americans have health insurance. You know what? I support that 100%. And let me tell you why. Every single democracy that we compete with in the world has provided health care to their population for 60 years. Britain, Canada, France, for 60 years have had insurance for citizens and a universal health coverage. They're all different. They're a little different, every one of them. But they've done it, and generally, Raul, they've done it at half the cost of United States health care today. The President has said 4 things. 1, we're going to cover every American. That is the right thing to do, the moral thing to do. Number 2, we're going to reduce the costs of health care. We cannot sustain the growth in health costs in our budgets today. If we sustain this rate, it'll be a quarter of the budget in 10 years. Can't be done. Can't be done at the county level, can't be done at the state level, can't be done at the federal level. 3rd thing he said is that we're going to make sure that people who do have insurance can take it with them, that they can move, and insurance is portable in this country, which it's been in all the Western democracies for 60 years. And the last thing he said is it's going to be revenue neutral. What does that mean? That means they're going to identify how they're going to pay for it. The way of paying for it is going to be sustainable, and it's going to be out in front of the American people so that you can vote on it and say, I trust that. There's 3 broad things that they're talking about, 3 broad areas that they're going to use to pay for it. 1, by reducing fraud and waste that are in the system today. 2, a surcharge or a tax on people making, in some bills it's $250,000, and in some bills it's $350,000 a year. And the 3rd one is from savings that are coming from different parts of the military budget. Those are the 3 areas that are on the table today. Might those change? They might. Is it something you have to watch for? You bet. All of these issues, and I've been in the rooms in Austin when we're talking about these bills and how we're going to pay for things, the way they do it is they come and lay out, here's 100 different revenue options to pay for it, and here's what it's going to cost if you do this segment or this segment of the population. And they have pretty good projections about what the cost will be going out. When you hear the $1 trillion number in D.C., that's 10 years. The cost is $100 billion for 1 year. So let's remember, it's $100 billion, and the question is, if we're going to do that, where are we going to come up with the $100 billion and the responsible way to pay for it? So let's look at what this thing is talking about. Employers with less than $500,000 in payroll or with fewer than 25 employees will be exempt. There will not be a mandate with respect to those employers. Other employers, those that might have over 500,000 or more than 25, would have to provide coverage to employees or pay a fee equivalent to 8% of their payroll. Massachusetts now been doing this for 2 years. The state passed a bill. They have a program going that's based on nearly that same provision. creates a public insurance plan that would offer several policies with varying levels of benefits, closes a gap in Medicare coverage of prescription drugs known as the donut hole, provides government subsidies to make insurance more affordable for people with incomes up to 400% of the federal poverty level, which is $88,000. Very important piece of coverage for El Paso, Texas. And then finally, expands Medicaid, the eligibility to cover those who make less than 133% of the federal poverty level, which is up to $29,000. So they're growing Medicaid, and the subsidy will cover people all the way up to, in this case, $88,000. So that's what's on the table. Impact on El Paso, this is out of the CBO report. They've done this by congressional district. Of the 232,000 uninsured individuals in the district, 211,000 uninsured would gain access to health insurance. To me, that's a very important issue in El Paso, Texas. 10,000 small businesses would be eligible to receive tax credits. In 2008, 1,010 families in the district were bankrupted as a result of health care costs not covered by insurance. And what this would do is cap out-of-pocket costs at $10,000 per year, ensuring that no citizens will have to face financial ruin because of high health care costs. 5,000 seniors would avoid the donut hole, and the tax, the surcharge, let's be honest about what they're talking about. They're talking about reinstituting the income tax level that was on high wealth individuals back about the time Clinton took office, and that surcharge would be on folks that make over $350,000 a year. That's 1,300 households in El Paso today. That's who it would affect. It's 0.05 of the population of El Paso. Now, let's talk about what the myths are. Socialized medicine. If TRICARE is socialized medicine, then what the president's proposing is socialized medicine. It is government dollars going to support and subsidize health care. And to me, we've had that in this country for 60 years. TRICARE, Medicare, Medicaid are programs supported in part by federal dollars and CHIP by state dollars. These are all programs that have some component of federal tax dollars and state tax dollars to subsidize insurance for folks in this country. Number two, death panels. This is one of the most bogus pieces of information that's come out in this debate, and let me tell you why. In my real life, civilian life, instead of making $600 a month as a senator, I try and sit down in a law office and get a few clients in once in a while, and nearly every time I sit down to talk to folks about their will, they want to sit and talk about end-of-life decisions and the choices that they're going to make in documents that they sign that get given to hospitals. They want to talk about, if I am in the end of life, whether I want to be resuscitated in certain situations. Why do they want to do that? Because in almost all instances, they're not in a position to make those choices. And they give an agency, they give the right to someone to speak for them, and those documents have been part of Texas probate law for probably 10 years. That provision in the early drafts of the bill, it's not there anymore, was to say you can get counseling for that, and if the medical provider is there, they can arrange for the person to come in to talk about it. That's all it said. The final here is hurting small business. I could give you 5 reasons why I think El Paso should be the #1 business community to step up and say, let's do it. And I'm going to tell you the first one. When you walk out and you get 211,000 more people covered with health insurance, you've just grown the pie in one of the biggest private employers that we've got in this county, which is private hospitals, private doctors, private clinics. That is a direct infusion into one of the most profitable and also enduring parts of our economy today. Second, manufacturing. This has always been a manufacturing base in this country.